Go.
Alright, so next we're going to be moving on to your mouth and your throat. Is that okay with you?
Mm-hmm.
Okay, so just by inspection, I'm going to be inspecting your lips. There's no lesions, no excessive moisture, dryness, or anything, no bruising, no abnormal like bumps or anything. So next, I'm going to be inspecting the inside of your mouth. So I'm going to ask you to open your mouth, stick your tongue out, and I'm going to check your buccal mucosa, your teeth, your gums, your tongue, your oropharynx, and your tonsils. So can you go ahead and open and stick your tongue out? Alright, good. Everything looks good. So your tonsils are visible, about 1+, and your buccal mucosa is pink, moist, and there's no signs of lesions, abnormal swelling, or any ulcerations in your mouth. So next, I'm going to be testing your cranial nerve 9, which is your glossopharyngeal, and then your cranial nerve 10, which is your vagus nerve. And by doing that, I'm going to ask you to stick your tongue out, open your mouth, stick your tongue out, and say "ah" for me. So go ahead and do that. And your uvula vibrates, which is normal. And so next, I would test her gag reflex, which I'm not going to do in this video. But so moving on to your neck, I'm just going to start with inspection, inspecting your neck. There's no abnormals that pop out. There's no lesions, bumps, bruising, anything like that. It's symmetric, and I'm going to go palpate and just look at it. So next, I'm going to be testing your range of motion of your neck. So can you tilt your head down, tilt your head up, all the way back, to the side, turn to the side, and to the other side. Okay, now we're going to do it again, but with resistance. Lean to the side, other side, and down. Okay, so next, so your range of motion was good. There was no pain or tenderness with any movements. Okay, so next I'm going to be testing your cranial nerve 11, which is your accessory nerve. And by doing that, I'm going to place my hand on your shoulders with resistance, and I want you to shrug upwards, and we'll check that. So go ahead and shrug. Good. Everything's good. She was able to push against my resistance, no lagging from one side. So next, I'm going to be palpating and auscultating your carotid arteries, which is in your neck, and I'm only going to do one at a time to make sure I don't cut off any blood flow. Okay, and I would count and get a count number for that. And same for the other side. There's no abnormal feelings, no abnormal, your rate and rhythm was regular, so it's good. 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 All right. So there was no presence of a bruise or anything like that. Everything sounded good. No abnormal blood flow, turbulence, or anything like that. All right. Next, I'm going to have you sit up on the bed, scoot to the end, and turn around for me so I can check the back of you. Okay, so I'm going to be palpating your trachea. So I'm going to be palpating from behind. It's midline, and it's movable. So I'm going to have you swallow. Okay. And next, I'm going to ask you to turn forward this way for me again. And I'm going to palpate your thyroid gland. So, good. No abnormal enlargements or anything like that. And next, I'm going to auscultate your thyroid gland as well. Alright. Sounds good. No abnormals with that. Alright. So next I'm going to have you lay down for me on your back. And here I'm going to be assessing for jugular vein distension. So when I tell you to turn to the side, let me check and see if your vein pops out. So turn your head that way for me. Alright, good. No sign, it did pop out, so that's good. You have you sit back up for me, please. To feet this way. Alright, so next, moving on, I'm going to be checking the posterior and lateral aspect of your chest and your lungs. So first I'm going to start with inspection, of course, checking your thoracic cage. In most situations, the patient would have like a gown, and we would check the skin, of course, throughout the entire assessment. So we check the skin for any abnormal bruisings or lesions or anything like that. For this case, we're just going to check this part. Looks good, and no abnormals with that. So your shoulders are symmetric. There's no drooping of one side. Okay, next I'm going to have you, turn to your back again for me, please. And I'm going to start by inspecting the spine. Of course, in a hospital setting, the patient would have on a gown, so we'd be able to see her bare back. And just making sure everything's midline, palpating your spine. Any pain or tenderness? All the way down, alright. Alright, so next I'm going to be checking for symmetrical chest expansion. So, bend down right at the end of her. I'm going to have you take a deep breath in and out. Good. So my hands move symmetrically, the chest expands symmetrically, so that's good. And then I'm going to be checking for tactile firmitis. So I'm going to use the undersides of my hands, and I'm going to have you, once I place my hands on there, I'm going to have you say 99. Okay, say 99.
99.
Okay. And vibrations were symmetric. There's no abnormals present. Alright. So next I'm going to be percussing over the lungs, the lung fields. Just going from side to side and comparing bilaterally. So. Okay. Any pain or tenderness?
Mm-mm.
So symmetrical bilateral, no abnormals that pop out upon percussion. Next, I'm going to be auscultating the breath sound. So I'm going to have you say breathe in and breathe out. So just take deep breaths for me. All right. In and out. 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 And in and out. Alright, good. There were no presence of like bruise or crackles, wheezing, or anything abnormal. No adventitious sounds within percussed or auscultated. And next, I'm going to be checking your costovertebral angle. So I'm going to place my hand and palpate or percuss that for checking the kidneys on both sides bilaterally. So. Okay. Any pain or tenderness? Alright, good. So next, we're going to be, maybe turn back this way for me, please. I'm going to be checking the chest anteriorly, so from the front. And I'm going to start with inspection, of course, always checking skin for anything abnormal, nothing pops out. So I'm going to next move on to palpation of your, I would palpate your chest wall and your skin, making sure everything's good. Alright, so I'm going to percuss over your lung fields, and you let me know if you feel any pain or tenderness upon percussion. So. Okay. No abnormals present with percussion, and I compare those bilaterally, left or right. Next, I'm going to listen to your breath sounds. Same thing, I'm going to have you take deep breaths in and out. 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 And in and out. no presence of any adventitious sounds from the anterior aspect of the chest. Lastly, next, I'm going to be palpating your lymph nodes. So I'm going to start with your subclavicular. So here, no enlargements, no pain or tenderness. Okay. Next, I'm going to move on to your central axillary. No pain or tenderness.
No.
Just ticklish.
Very.
No pain or tenderness.
No.
Okay. And then your brachial. Alrighty. Alright. Any pain or tenderness upon any palpation? Okay. So there was no enlargements, so no signs of abnormal lymph draining or anything like that. Alright. So moving on. I'm going to do your range of motion of your upper extremities. So can I have you stick your arms out for me? And bring your arm in. This other side. And do it again. Good. Okay. So, and the next time I have you do test your muscle strength against resistance, can I have you pull your arms up like this, and when I pull this way, you pull back. Good. So it's equal bilaterally, no drooping, no lagging of any time or any side. It was good strength and equal. So next I'm going to be palpating for your epitrochlear nodes, lymph nodes. So have you stick your arm out. Alright. Good. So no enlargements of those lymph nodes. Was there any pain or tenderness upon palpation? Alright. So next I'm going to check your radial and your brachial pulses. So, starting with your radial. I would count that for 30 seconds and then get my measurement. And then do the same thing to the other side, compare bilaterally. And the same thing with the brachial pulse. That, compare bilaterally. Alright, good. And, alright, so moving on, or throughout this assessment, I would be checking her arm, presence of like her arms, her skin, and shoulders. Of course, skin and no characteristics throughout the entire assessment, and just making sure there's no abnormals on any parts of the body. So, next,